Welcome, everybody, here at Living Chassidus. We have an amazing lineup of speakers for our life skill series. And one of the most powerful parts of being a woman, exactly, especially in our community and also just in general, is the fact and the beautiful miracle of giving birth and being able to have children. And with that, sometimes we might forget that there comes the aftermath. There comes what happens after you give birth. A lot of us spend time. I remember for my first, I spent a lot of time doing classes in preparation for labor and how to deal with, the contractions and giving birth and pushing and all those beautiful parts. And I also remember after I had my newborn and I was home with my husband, and I kept wondering, what now? I didn't prepare for this as much as I prepared for birth. So we decided that it would be a very crucial and valuable time spent if we spend a little bit of time discussing what happens after birth, what happens for ourselves, and how to really. The way I see it is kind of like in the airplane when they come and they tell you first put on your oxygen mask and then help others. And if you as a mother are not taking care of yourself, if you as a mother are not in a strong position, then it's very hard to be there, not just for your newborn child, but also for what comes after, um, for your body, for yourself, for everybody else. And we are so lucky to have tonight. Let me see if I have give me 1 second. Here. A big, big thank you tonight to our, hold on, to our anonymous sponsor who sponsored in honor of all of the mothers and the soon-to-be mothers. And we're so lucky to have you. May Hashem bench you and give you only birthdays and revealed good. Thank you so much for sponsoring tonight. Oh, I'm not finding on here. Okay, plan B. Here we go. Okay, so tonight's speaker is the amazing midwife, Tania Zirulnik. She is a CM and LM. She's a native of Lima, Peru, and she has been an active participant in the birthing process for 20 plus years, providing primary, prenatal, and postpartum care to women of childbearing age, supporting their journey into motherhood. So we're very lucky to have you here, Tania, and I will pass the mic over to you. Give me 1 second. Here.
Okay, here I am.
You should be able to.
I couldn't hear you. Kind of cut off. I don't know if it's your internet or mine.
Can
you hear me?
Yeah, can you hear us?
Okay, I can hear you. Yes. It's just you seem frozen, but I don't know if it's my image or you are frozen. I don't know, but if you guys can hear me, then that's fine. I think we lost. Oh. Yeah, I think maybe I'll just go ahead and start because that was, I think, what was supposed to happen. And if if possible, and people can turn the cameras on, that would be great. Hi, Haya. And so just that way I can see some of you. Hello. It makes it a little bit more personal for me to share, to go through this conversation. Um, and I think Michal said a lot of kind of was what I was planning on saying. Postpartum, it's so important, but so just left as the last thing we need to worry about, when it should kind of actually be the opposite. Because when we prepare for the birth, right? Like Michal was saying, like you take the classes, you prepare for all these things, and we all think that the culmination is the birth. But really, the birth opens the door to what's going to happen afterwards, which is motherhood, which is having a new life and a human being that depends on us. And at the same time, we are recovering from 9 or 10 months of changes that happen to our bodies. So we're not just recovering from the one night that we didn't sleep because we were a neighbor, but through 9 months, our body created a human being and produce more fluid and make the heart work harder and stretch the muscles and created new cells and all that. So that was a big change. And so now that all has to, in a way, reverse. And so we cannot expect that from one day to another or one week to another, everything is just going to be perfect. And I think same way we say prepare for the birth, maybe prepare for a wedding, maybe prepare for a big birthday event, or when we plan, like we're like, okay, we want the balloons and we want the cake and we want all those things. That is the same preparation we should have for the postpartum. And what would that look like? First of all, and I think if there's one thing that I want everybody to take from this, is rest, slow down. Like, I think that's the big one. We, especially because we live in a city, we're not used to resting. We're not used to sitting down and just not doing anything. Right? It sounds weird. Like, it's like, okay, this is boring. I'm sitting down, not doing anything. Right? Like, why? It's a waste of time. But if we think about it, the sooner we take that rest, the more serious we are about that rest, our recovery is going to happen faster. If we don't pay attention to that rest, our recovery is going to take longer. So there was this one day I went to do a postpartum visit on day 3. And when I walked in, my client, she was vacuuming her apartment. Very cute. And I was like, what are you doing? And she was by herself with a baby and like trying to vacuum the apartment. And I was like, no, you should be resting. So the first thing is, remember, you just had a baby, so your body went through all these changes. You lost blood during the birth, even if it was minimal blood, but it was more than just getting a cut on your finger. Like, you lost certain amount of blood. Your body went through eliminating a lot of weight and a lot of fluid. All that happened in that like 24, 48 hour, however many hours the labor lasted. And so plus you didn't sleep probably for a one night, at least, if not 2 or 3, right? So the most important thing is for you guys to stay in bed. I'm going to say in bed. What does being in bed means? It means laying down, not serving anybody. With your baby in arms or next to you or in the crib or in bed for at least the first 3 or 4 days. Okay. So that probably is to care for my other children, or to I don't know, do the dishes, or you know, just go grocery shopping. Who is going to help with that, right? Maybe your mother is coming and is staying with you, or maybe you're going to your mother after, giving birth, the day after or something like that. Which, I mean, okay, you're still not in your bed, but if at least going to your mom means that you are going to be in bed, then that's going to be helpful. But um, so we have to think ahead of time. Okay, who's going to be that support person that is going to hold us? And that includes the husbands, because sometimes, you know, sorry if this is an unpopular opinion, but sometimes the husbands, I go visit and my person is alone and the husband has gone, and it's not, she doesn't know when the husband is coming. And I understand the husband has things to do and all that, but I think it's important that we make our husbands also understand that it's important that they're around us. I even tell my clients after they give birth, right before I leave, because I will stay for 3 hours after they give birth, and I say, the next time you wake up to go pee, don't just go pee in the dark by yourself. I want you to wake your husband up and tell him that you need to pee and that he should walk with you to the bathroom. That's how serious I am, because I think the person needs support, right? And in very few cases, sometimes people get dizzy, could faint, just simple things like that. But that's how important it is to have someone with you. Even if you have the most natural, perfect, uncomplicated birth, it's always good to have that support. So we create a plan. Who's going to help me? Who's going to feed me? And who's going to clean up? And maybe just in case, who's going to help me with the baby in case, say, I need a lactation consultant or something. Do I have create a list of names ahead of time? Okay, I have the referral for a lactation consultant, the names, so that we're not starting to ask, on that moment, who can help me. And so I think, there are some doulas here, so maybe you can even help them while they're, having meetings with you. Just help them create that little list. Okay, just in case, I'm going to give you these. These are resources for you to have, and just have it handy if it's necessary. So rest, like I was saying. The first thing is 3-4 days in bed. You can walk to go pee, to go to the bathroom. You can walk to go to the shower. And then the rest is in bed. What else do we need for postpartum, for a good recovery? A lot of good food and good hydration. Okay. So what does good food mean? And I'm always very happy that, especially I've seen this in the Crown House community. I've seen this in Williamsburg, where you guys help bring food. And I feel that that's so important and so great. So make sure the food that, if you help cook that food, or if you are the one receiving it, make sure it's a really good balance. Food that has fiber, that has protein, that has iron. Because remember, if you lost blood, iron is what's going to help build that blood up. If protein is so important for the muscles, and to help recovery, and fiber is good to help you go to the bathroom, because if some of you have had babies here, you know that sometimes you have your baby and then it takes a day or two to go to the bathroom. And then we want to make sure that that first day of going to the bathroom feels okay. So fiber, super important, right? So fruits, oatmeal, and the fruit should have skin, right? So apples with skin, peaches with skin, um, um, and oatmeal, um, avocados have fiber also. So definitely flax seeds, chia seeds. Those are super super important foods to consider after. So again, have this. Make sure you have these at home for the time of the birth, and then you can eat a lot of these, and then you'll have a nice soft bowel movement that won't be too much of a big deal, especially if you have stitches. Sometimes it can be scary for some people to go to the bathroom, um, especially if the stools are hard. But if we work towards that, hydration also contributes with that. So make sure again you have hydrating fluids, and sometimes water is not enough, so you kind of want to make sure you include other things, maybe cucumbers, maybe watermelon when it's in season, because that also provides your body with water. When you're breastfeeding, for those who choose to breastfeed, it breastfeeding takes a lot of water from you, so you want to make sure you replenish. Also, after you give birth, you pee a lot and you sweat a lot, and it's because you're eliminating all that extra fluid that your body produced during the pregnancy, right? That your body produced 50% more fluid. That's when we get all swollen, our legs, our ankles get all swollen. So now it's time for this to come out. So we peed, we sweated, but if you're breastfeeding, sometimes you also need to replenish really quickly. So lots of fluids. Make sure you have either a big cup or maybe like a water bottle next to you all the time, because remember, you're going to be resting in bed, right? So you don't want to have to be getting up all the time to get some water. Just make sure you have it right next to you and you just drink. I'm not going to say you have to drink 2 liters or 3. Like, no, just drink often, right? Drink to feel satiated, like just to to feel that you're okay in hydration. Um, okay, what else? Any questions so far? Just you guys can interrupt me if I need to go deeper into anything that I that I mentioned here. Um, Sunlight, daylight. Okay, so when we reach day 5 postpartum, our hormones start to drop. Between day 4 and 5, our hormones start to drop, and with that, it makes us feel a little, like our mood is a little unstable, maybe a little sad, maybe a little anxious, maybe a little weepy. And then remember, we need to allow ourselves to feel those things. That's a normal feeling. And that's normal because your hormones are dropping. Same thing maybe when we're going to get our periods. Do pregnancy food aversions go right away? Right away. For most people, right away. Yes. Um, okay. Back to even heartburn. Like for some people, it's like heartburn has been so bad during the pregnancy, you give birth, goes away completely. Okay. Where was I? I forgot. What was I saying? Oh, the mood changes, right? So, um, it is normal to feel that your mood is different the first week after the birth, right? Again, like I said, it can create a little bit of anxiety, a little bit of sadness, and it's okay to feel that. We can't just say, no, I'm strong, I don't feel those things. We all feel it in different, say, intensities, right? And something that helps a lot to help your body balance these hormones that are like dropping and other hormones are increasing, um, is to get some daylight and vitamin D. So if you're low on vitamin D during the pregnancy, make sure you really work on increasing your vitamin D levels, because vitamin D levels can help with mood disorders. So we want to make sure that you're good with that. And so sunlight, it makes you feel good, right? When we start the day, we open the curtains and it's like, oh, it's daylight. So that helps a lot. How can you get that light in bed? Well, you open your curtains, so make sure, hopefully you have a bedroom that you get light. There's even on Amazon, they actually sell, I don't know what they're called, but for people who have like very dark rooms, you can buy a special light bulb that you put in a lamp, and it actually produces the right amount of, I think it's called lumens. I can look it up and send it later, but it produces the right amount of lumens to help with, kind of make it feel like it's daylight. But for the most part, I say when you wake up, open your curtains. Open the curtains, let the light in your life. And then as the day starts to progress, in the wintertime, it's hard. But if you're getting your vitamin D, you can also kind of like use that to kind of boost your mood, boost your immune system also, because it helps to, vitamin D helps to make your immune system stronger, right? So definitely vitamin D and light during the day. And then as the day starts to get darker, then you can start to close your curtains if you want, to kind of get your body also into that rhythm. That's what we call the circadian rhythm. If we're daylight, your body produces certain hormones. Nighttime, your body produces other hormones that relax you. But if we're in the dark all day long, your body just makes you just be down all day. So very important to let light in your life when you're postpartum. Now, what happens if these feelings of anxiety and sadness stay for longer than a week or two? Maybe they start to get more severe around week 3 or week 4. And we talk now more openly about postpartum depression, and don't never be afraid to ask for help. Even if you feel that maybe this is just normal, but just talk to someone, whether it's your provider, maybe your mom, maybe your husband. Ask for help. There are a lot of resources out there, a lot of support groups. There is nothing wrong to saying out loud, I think something's wrong. Because the earlier we can help you, the sooner you're going to start to feel better. Like people say, some people have to get on medication, for example. And people say once they get on the medication, it's night and day. Like it's so life changing for people who develop postpartum depression. Some people just maybe don't need medication, but do therapy, or just like support groups. They find that it's just so helpful. We shouldn't see postpartum depression as a sign of weakness. It's something that is not necessarily under our control. Again, if our hormones drop and we're having a hard time bringing a balance, that eventually leads us to postpartum depression, that's not on us. That's not, it's just the biochemistry in our brain. Some people who are already anxious or already suffer from depression may have a higher incidence of developing postpartum depression. So it's also important that during the pregnancy, if they're on medication already, it's very important that during the pregnancy, they keep taking this medication, they keep it adjusted based on their needs. But really, don't be afraid of saying to your close person, I think something is not okay. It's not going to go away on its own. If it's really starting to affect your life, again, you feel so anxious that you cannot take care of the baby by yourself. You feel so anxious that you can't leave the apartment. You're afraid of going outside. You feel so anxious that you think the opposite, that nobody can take the baby, can take care of the baby as well as you do. You cannot leave your baby alone with anyone because only you can do that. Those emotions that go past, that go to this degree, that needs to be brought up. Okay, because it's not going to go away on its own. Or if you maybe notice your sister, your friend, right, that is maybe starting to act like that, then bring it up to her, bring it up to the husband, to the mom, so that they can help her. Again, like I said, usually it doesn't go on its own. And once this person gets help, the change is usually very fast. And it's such a good thing. It's so beneficial for that family and for the good care of the baby as well. And it does not, usually the medication does not impact breastfeeding. So if this mom is planning on breastfeeding, she can continue doing breastfeeding without problems, even if she has to be on medication. Okay, so that's super important. Okay, so we said rest, good nutrition, light, the emotions. What else? When is the right time to go outside? Okay, so let's say you were really good, you listen what I'm saying here, and you stay in bed for 3-4 days. Now you're like itching to go outside and be like, okay, can I leave my apartment now? Well, it all depends. Maybe you got stitches, and I normally tell people do not leave your apartment until 7 days to make sure those stitches have really healed well. When somebody gets stitches, we're putting one side together with the other side, right? And we want it to stay still so that it really gets together. Now, if you're walking, right, this moves. So the stitches are trying really hard to keep things in place. But if you're moving a lot, then it's not helpful, right? So if you have stitches, my recommendation is don't go out for walks yet. If you live in an apartment that has many floors, maybe you're on the 4th floor and you have to go down the stairs, don't do it. Don't. Stay in your apartment. You can move around your apartment a little bit, but don't go out. Maybe you didn't get stitches, and maybe this was like your 3rd, 4th baby. You're like, I have all the other kids, I need to take them to the school bus. And well, again, if you're on the 1st floor, you can probably take them to the school bus and back. But if you're on the 4th floor, you need to understand, you need to take it easy still, right? Remember, your body's still adapting to not being pregnant. So can there be somebody else that takes the kids to the school bus? Right? This is what we plan ahead. Okay, so maybe the husband is going to be the one that for the next 2-3 weeks at least is going to make sure to take care of taking the kids to the bus. Why? Because you're nursing, because you are resting, because you're waking up in the middle of the night, oftentimes breastfeeding your baby. So on top of all that, there shouldn't be the expectation that you have to wake up and get the kids ready and get the lunches ready and get them out of the bus while you're also breastfeeding the newborn, right? So again, ideally have somebody that takes care of those responsibilities, from getting the kids ready to packing lunch. It is very important that somebody else takes care of that. You should, if you're waking up, let's say at 2 in the morning, again at 4, and then again at 6, the idea is that you take a nap from 6 to 9 at least, right? So that you can still continue resting, catching up on the sleep that you didn't take. So somebody else should be doing all those other activities that normally get done between 6 and 9 until the kids leave, right? it's, if you have a sister, somebody, maybe there's postpartum doulas that sometimes can help. I don't know if it's, I actually don't know if it's common in Crown Heights. You guys use a lot of postpartum doulas, or is usually the family? It's usually the family that helps, right? Yeah. Well, then get the family involved. um, uh, Maybe the older kid can help also, right? Like maybe the lunches get prepared the night before. I don't know, things like that. So that it just makes it a lot easier. Um, okay, so and also important to take naps during the day, the first week at least, if not the 2 weeks. But again, if you're waking up during the night, you have to recover, and during the day, that's when again rest. So after everybody has left, there's a sweet postpartum doula. Not everyone has family care. Okay, so there are postpartum doulas. Thank you, Hayamusha, for sharing that. And okay, yeah, so perfect. So we have a postpartum doula, at least one, for people who don't have the family, who don't have the support. It's very important. When I had my second child, with my first, everything had been so easy that I was like, oh, I got to handle the second time around. I so regretted it. I was like, this would have been the perfect time to really think of a postpartum doula. And I kind of neglected that because I thought it was just going to be as easy. But when you have other children, you have to feed those other children and all that. So okay, so what else do we include in our planning? Laundry. How you guys? Does anybody get help with laundry? Is there? I mean, cleaning persons, right? Like there's cleaning people, and they do laundry too when they come. Okay, great. All right, so that's handy. I don't want to see anybody doing laundry then, in or folding clothes. Perfect. So if anybody if most people can afford having a cleaning person that does all the cleaning and the laundry and folding clothes, amazing. If you don't have that service while you're pregnant, but maybe you can ask, a parent or anybody, like, hey, would you please pay for that person for me to have a cleaning person for the first week or two, right? Or maybe, I don't know, maybe people make a fund or something, like, just to really not have to worry about laundry, because that's a big one. Folding and doing laundry, that's a big thing. And so definitely make sure you have that in your plan, that somebody takes care of that. There's no reason why you should be having to be worrying about that.
Can I add a little thought to that?
Yes.
Yeah. So it's also a great idea if you're able to train them in on your ninth month. So that way they already know what they're doing and you can actually take your time postpartum. Your ninth month is also hard and you're carrying a big baby, Baruch Hashem, so it's not so simple to do laundry, but also that way you feel comfortable. And I think that was a hard thing for me, that I was like, okay, but how am I going to learn to delegate to this person when I'm meant to be resting? So I say train whomever is meant to do your laundry or whatever help you need, if they can do it on the ninth month. Yes. 1 second, let me fix the. Here we go.
Okay. Yeah, definitely. I think it's easier, like you said, learn how to delegate, and so that is not one more thing you have to do when you're trying to rest, for sure. So start the service on the ninth month, so the person already knows also what needs to be done, how you like the laundry and things like that. Okay, so we have laundry can also be done by the laundromat. Okay, many have wash and fold. Yes. and then the husband of the family is the one taking the laundry there. So I think the husbands also um, need to have. Okay, there's more information here. Sorry, before I move on to the husbands. Push LinkedIn help for those who don't have to. Okay, so there are resources. You guys can see the messages. There are resources there for the laundry, the pickup, the drop off, and all that. So I'm glad to hear that that also exists. Okay, now the husbands. I have found um I have a mix. I have different groups of husbands. The ones that are very on top of things. Okay, what do you need me to do? I'll do it right now. And the ones that the mom gives birth and they disappear. And I'm like, I don't know if I should actually leave. If I don't want to leave this person who just gave birth and is still, vulnerable. I don't want to live and and see that she's still alone, and I don't know what time the husband is coming. So I think as part of the preparation of, again, right, this plan for postpartum that ideally you guys should be creating, it should include the husband, and it includes the husband should stay home for at least the next 24 48 hours, is if not the first week, because um and I do understand, sorry, that I know sometimes they have to go pray to the synagogue, and and sometimes I do tell them, listen, I'm not leaving for another 30 minutes, so if you need to go now, and then make sure to come back so I can leave. But if there is a way to make them understand, because if they are not if they have not been told ahead of time what is the role in this process, right? You cannot expect someone to just say, oh yes, I'm going to stay. Some people do it, not everybody, right? And I don't know if throughout the pregnancy or when they're going to get married, like, do husbands get any preparation of what their participation is going to be right after the birth, or not really? I see people like smiling. um Sounds like no. Okay, so
It's something we're working on, but it's not so common these days.
okay, so we need to prepare our husbands. We need to let them know. Extremely minimal, yeah. So I recently had this is I thought it was so cute. The husband was very um shy. I mean, at least he wasn't talking to me, which I understand. But it wasn't until I said, my client had given birth and he was in the living room, and I said, she needs breakfast. I mean, it was like 2 in the afternoon now, but she hadn't, I knew she hadn't eaten. So I said, she needs breakfast. And he said, on it. Like, I was like, okay. He got up, ran out of the door, came back. I seriously don't know where he went to get the breakfast, because it took him like an hour to come back. But, he came back with breakfast and balloons and a cart. I think that's why it took him so long, because. So I felt that he just needed that little push, like he just needed the switch to be turned on. And then he like, oh, okay, yes, that's my function. And so I think if we, again, as part of the preparation for the postpartum, we need to include them, and we need to let them know, hey, I'm going to need you. I need you to be here, even if it's just to be here, right? I personally, as a professional, I need them to be there when I leave and for the next 24, 48 hours, which is the critical time, especially for home birth, is the critical time when somebody gives birth and there could still be cases like bleeding or maybe even issues with the baby. And of course, I make sure to leave and make sure that everybody's stable and okay. But, in certain cases, things can happen. And I need my client to not be alone. So I need the husband to be my eyes and my ears while I'm not there, right? I need him to take over the care after I leave. And that could just mean, hey, somebody's knocking at the door, is leaving food. I'll go get the food. I'll bring it next to you. Um, do you need me to get you more diapers? Oh, there's no more toilet paper in the bathroom. Where do I get it? Right? I mean, my husband didn't know where we stored the toilet paper the other day. I was like, seriously, after all these years, you don't know where we put the toilet paper? I don't know your husband's, but you know, so, so I wouldn't want to be the one getting up to get the toilet paper out. So he should know where it is, right? So just very simple things like that, so that you don't have to have the mental load of knowing where the toilet paper is, but also the physical exertion of having to get food for yourself. That's why we need the husbands there. We need them to maybe hold the baby while you're taking a shower, so that you're not like in the middle of the shower hearing the baby cry and you have to rush to get out of the shower because the baby's crying. We need to know that the husband is going to be holding the baby and calming the baby down, right? We need to know that if maybe the husband is the only other person to pick up the kids from the mom or the bus or whatever, we need to know that we can rely on them, and that even though they have their own obligations, they understand their importance, the importance in their participation, so that they can plan their own obligations ahead and just move things around if possible. I feel that if we don't let them know ahead of time, they're not gonna get it, and they're only we can make them understand. You all know the level of attention that you need. And maybe the people that are present on this conversation, maybe they're on their sixth baby, maybe on the 10th baby, or maybe on the second baby. And you're like, oh, I got it. I've done this 6 times. But wouldn't it be nice to not have to, okay, I lived through 6 times of doing this, but wouldn't it be nice the next time to just not have to worry about all those extra things? And maybe just be, hey, I think it's time we prioritize you being home to help in the morning with the kids so I can sleep a little extra. Because probably your husbands are not waking up in the middle of the night, right? To nurse the baby, right? And if you're the one nursing the baby, you're probably the one changing the diaper. So your husbands are probably sleeping through the night for the most part. Um, but maybe you need your husband to change the diaper sometimes, right? Maybe after the breeze, the husband can be the one that takes care of doing the cream and the diapers and all that. So um so that's also, I think, something that is so important, because to be honest, sometimes when I go to visit someone and it's my postpartum visit on day 3, and I get there and it's my patient the one opening the door, I don't like that. She should not be the one opening the door. I don't want her to be the one opening the door for me. I want somebody else to say, come in, she's resting in her bedroom. That's what I want to see. And then when I see that, I know that person is well taken care of. Okay? But if she's alone opening the door to me on day 3, it worries me, because I feel that that person is not getting the attention that she needs, the rest that she needs. And again, maybe she's done it for so many times that she's just used to it, but it shouldn't be the norm, right? We shouldn't be the ones that, oh, we just do it all. We shouldn't. It's great to know that we're strong, but asking for help, having our husbands be our helpers, doesn't make us weak. It actually makes us stronger, because it allows for better recovery. So when we are recovering from postpartum and we're having things like maybe we sneeze and we pee on ourselves, maybe we cough and we pee on ourselves, maybe our abdominal muscles are like not the strongest. On top of that, we have to carry the baby, to go open the door, to carry the baby, to prepare my lunch because I'm by myself. That's not okay. That doesn't make you stronger. That makes you weaker and prolongs your actual recovery time. You might feel better, you might feel good, but it doesn't mean that your body is feeling excellent, right? We say 6 weeks of postpartum recovery, and some people, even by 6 weeks, are not really ready, right? Let's think about how people used to live back in the day. Sometimes we even find it, in biblical stories, right? Like how the women were supported by the women in the community, and like there was, everybody was holding her. That's what we still need. But now with the husbands involved, because now we're living in a different civilization, right? So it should be integrated. The husband should be integrated into this support system. Okay, any questions so far before I continue? No? Okay. Okay, my former boyfriend said after. Yes, yes, exactly. Other countries, they have it. They have the support still. 6 months. Amazing. All right. Canada has
Can you
maternity leave for 1 year. And the husbands, I think, have maternity
can,
leave for months. Yeah, go ahead.
can you say it out loud? Not
Oh,
everyone can see that.
the message. Um,
Yeah.
Haya said, my friend from Papua New Guinea said after a woman in the village has a baby, all her friends come over and make meals for her for 6 months and take care of her. 6 months. That's nice. I would love that. Right? So just that's how much they value, right? Because who's the engine in the family? Okay, you have the husband maybe making the money, you're home with the kids. But again, who knows where the toilet paper is stored? Who knows right? So we are that engine, right? And if we take too much, then we start to fail, right? So remember, the more we take doesn't make us stronger. It makes us weaker. Make our immune systems get depleted because of the stress we go through. Just for the mental load. Oh, I have to think, who's gonna take the kids to the bus tomorrow? How am I gonna make it? Oh, the baby's crying all night. It's 3 a.m. The baby's crying and crying. How am I gonna put this baby to sleep? I still have to wake up at 7 a.m. to help the kids get ready to go to the school, right? So, like, no, that doesn't help us, and that makes us weaker, right? So we need to understand, we need to prioritize what is important to me at this moment, that I am well taken care of. Somebody else, even my aunt, my sister, can take care of the other kids right now while I am recovering. It's a good beginning for the postpartum period. And as we start to get out of the postpartum period, it's almost like, it's like being in your cocoon, right? And then you come out as a butterfly, right? So the idea is that by the time 6 weeks come, and it might not be 6 weeks for everybody, it could be 5, it could be 7, it could be 8. You feel reborn, you feel like a different person because you were able to rest. Now you feel stronger, right? And hopefully the transition is easier, right? into this, okay, my 6 week postpartum recovery is over. But it could take longer. If you had a C-section, it could be 3 months, could be a year, until people are still feeling issues around their scar when you have um, um, an incision there. If you have a vaginal birth, maybe you've had, I don't know, 3, 4, 5 babies. You're having issues with your pelvic floor. Take care of that. Go to physical therapy, right? Because it's only going to get worse. You don't want to be a 50-year-old woman having to wear a diaper all day because every time you sneeze or cough, you pee. The time to take care of that is during this postpartum period. After the 6 weeks, maybe somebody evaluates you at 4 weeks, gives you the referral already. Start seeing a physical therapist. If you notice you're peeing when you sneeze or cough, you should seek help, especially if you want to have more babies. Like I said, it only gets worse and worse. And as we get older, we enter menopause. If that has not been treated, it takes longer to treat it afterwards. um, excuse me. Um, the the lactation consultant help I was also mentioning because I know when it's a boy and there's a breast, it adds stress to the situation. I'm sorry to say, but I often see, especially if it's your first baby, a lot of people stress out because the baby's not gaining weight, the baby's jaundiced, and there's a lot to manage during that first week to make sure the baby's ready for the breast. So sometimes having a lactation consultant that comes maybe on day 4 or 5, if something is not working well, it might be helpful to kind of hopefully resolve that issue. When I work with my clients at home, I'm a lactation counselor, so I kind of give them some tips. I try to help them so that we can alleviate the process and make the baby not be jaundiced by the time of the birth. But sometimes there can be very challenging situations that it needs to be worked out with a lactation consultant. So it's always good to have that name right on hand, like just ready to work with this person. And I think also something that I find very important is the relationship between you and your husband. A lot of things get very hectic after you have a baby. It could be baby 1, 2, 10, but every baby is different, and it's going to come with its own things, whether it's easy or more challenging. Like I said, my first one, easy. My second one had colic. I had to get off dairy for 6 months. Like, it was nothing like I had expected. And so it was completely different. It was more challenging. It's like I was barely talking to my husband after my second child, right? So something that is very important is find a moment to maybe have 5 minutes to talk to your husband. How was your day? Oh, this is what happened. How was my day? Don't lose your connection. Sometimes, we as families, we want to have babies. That what fills fill us up with joy. But you want to share that joy, those ups and downs, with someone, and that should be your partner, your husband. And so let's keep that flame, not just make it so like, okay, here, do this, that, blah, blah, blah. We all fall into these situations, right? Well, we want there to still be some love, some connection. So that is also something important. I always tell all my clients, um, set a timer, set a timer during the day so you can give. I know sometimes during a certain period you cannot give each other a hug, but at least, hey, how was your day? How are you doing? Did you sleep last night? These are my highlights. Even if it's just 5 minutes, 10 minutes, to just keep a nice, feel supported, feel that you can share with someone. We need, during the postpartum period, we need oxytocin. When you're breastfeeding your baby and you feel those cramps, right? Or you feel your milk let down, that's the oxytocin in your body. That's a hormone, right? When you kiss someone, hug someone, your body also releases oxytocin. It's the hormone of love. So when we are sleep deprived, tired, exhausted, stressed, it makes us cranky sometimes, makes us cranky. So we need some love. We need some oxytocin. So those 5 minutes with your husband can just give you the oxytocin you need to just keep you moving. So keep that in mind. Maybe remind your husband, oh, if you bring me flowers, makes me happy. Maybe he'll show up with flowers. Just little things like that. A diamond ring makes me happy. um, yeah. So that's also very important in the postpartum period. And then I'm just trying to think, because I think I mentioned the big one, the ones that I consider like very important, right? Like the rest, the how to know it's a mood disorder, eating, hydrating, connection with a partner, laundry, cleaning, and then the other things that you might just see which are normal, like if you maybe are expecting a first baby and you don't know what to expect from the postpartum period, is the bleeding. The bleeding can be annoying because it comes for so long. But a lot of people sometimes worry about, is this too much? Is this not too much? What does the bleeding mean, really? So if this is your uterus, when the baby's in there and the placenta is attached to the uterus, when the placenta comes out, it leaves a wound on the wall of your uterus. And so now your uterus is going to contract to make this area of the wound smaller. Okay? And so also the first few days, if you're walking a lot, you're going to bleed more, because with every movement you're kind of like reopening the wound. You know how when if you're cooking and you cut your thumb and then you keep cooking, you're gonna keep reopening the wound, right? So the same thing happens here. You're moving too much the first few days, this is not healing, so it keeps bleeding from here and you see clots, and so that's also why you want to rest after that first week. You know, you're probably at the point where it's kind of like a period, maybe the second day of your period. So it's kind of like coming. Still, you have to wear a pad, um, and then on the second week, maybe for some people, it starts to lighten up, like the first day, like the last day of the period, and maybe on the third week it's just spotting, and then nothing else after that. Or maybe for some people it just prolongs. Now, if let's say by the third week, it kind of like keeps being consistent, also make sure how much activity you're doing, right? Because if you're still like, oh, going out, going up and down the stairs, you're going grocery shopping, bringing groceries up, and all those things, you might want to realize, okay, this is, I think, what's causing the bleeding, right? So bleeding in a way tells you, it's like, hey, you're doing too much, you overdid it today. Maybe you weren't bleeding much and then you went, it was a long holiday and you guys stay up until late and all these things and visiting family and were on your feet a lot, so you're gonna bleed more. Definitely have, just keep an eye on bleeding. It'll just give you a lot of information of what's going on inside of your uterus. But seeing clots is not a bad thing. It's definitely going to happen. The more you're resting, right, what happens is the blood is just not coming out. So the blood just sits there and it clots, which is a normal process. And then when you stand up, the clot just comes out. Okay? So seeing little clots here and there. In fact, the first day after you sleep for a couple hours, you might have a huge clot that comes out. But after that, you may just see little clots here and there, and then eventually they don't show up more. But then if on day 3 it shows up, it could be because maybe you did too much. Okay. So just that's also an indicator. It's a good kind of like marker of, okay, how's my activity going? Yeah, and I think those are all the things that come to my mind. Michal, do you think there's something I'm forgetting?
Um, can you hear me?
I can hear you.
Yeah. Um, okay. So uh, two thoughts. One, I loved what you said about the husband involvement and us as wives speaking up and sharing what we need and helping them help us. It may not they may not intuitively know this, and no one else might tell them. So it's our job to tell them for our sake and for their sake to have a wife back at the right time. And then the other piece is, in my opinion, it's also sometimes connecting to friends who've also had babies and gone through, and sometimes just speaking out with somebody who can understand you, like what it was like, or how was labor, or just processing. I remember really enjoying just processing with a friend. And lastly is the fact that we get to save in our psyche and in our minds how the experience was and how we feel afterwards. So sometimes even just processing and saying, okay, maybe labor, as I joked on my status today, that labor is called labor for a reason. It's not a walk in the park generally, but it doesn't have to be a trauma that we get to carry as a trauma. We can also say, okay, that was hard and I did so well and I'm so proud of myself. And just even processing with somebody at this postpartum time, we have a lot of thoughts and a lot going on, and we also have the opportunity to just think about what that labor was like and how we're going to save that into our.
Yeah, that's certainly. I think it the talking to other people and processing experiences. I think that's a big one because some people, especially if it was their first experience, they could have had a traumatic birth and they might not even realize that it was a traumatic birth, and it's just there's just that's what it happened to them, that's what they think labor was, and then when they are able to talk to someone else they actually realize, oh well, hold on, that was mine was very different, and it helps us to process better the experience and to maybe even seek help if needed to process a traumatic experience. So yeah, it's good without comparing experiences. It's just good to know what normal looks like, and what is something that maybe didn't go so normal, and therefore we need a little help to process that. And then somebody was asking here, what are the signs of a postpartum hemorrhage? So, I mean, I'm just gonna say what I tell people under my care because, like I said, once they give birth at home, I stay for about 3 hours. 3 hours, assuming everything was uncomplicated, right? Somebody who didn't have a hemorrhage. I tell them, hey, if you soak your pad in less than 2 hours, and I mean soak, like it's heavy with blood, then that is a sign of a postpartum hemorrhage. So you need to call me. Now, postpartum hemorrhages are usually going to happen in the next 2-3 hours after the birth. So if you gave birth in a hospital, there was actually many years ago an article when they were talking about postpartum hemorrhage, and somebody was saying, it was a quote, it said, if you're in the hospital, don't clean up your bed. If you're bleeding through the sheets, call the nurses, let them know. Don't just cover it and clean it up because you thought, oh, it's just dirty, right? So sometimes hospitals, if they're too busy, they're not checking on every patient, they're not checking the bleeding. But definitely, if you notice in the hospital that it's really overflowing and it's getting on the sheets, you need to tell someone. Now, For me, if I have someone that actually has a postpartum hemorrhage at home, which I have had clients, I stay with them until they're stable, right? And that means possibly staying 5, 6 hours after the birth to make sure this person feels okay. And I give her an IV and all those things. Um, and so in that case, I make sure that I can leave and that she's still not bleeding heavily. Um, does that make sense? My friend had a severe hemorrhage sometime after, maybe a day or so later. Okay, yes. So in some cases, and I don't know the circumstances, your friend's circumstances, there can be retained pieces of the placenta in the uterus, meaning the placenta didn't come out completely. So remember, I was talking about the wound that the placenta leaves. If there's still a piece that was there that didn't come out, it's going to prevent the uterus from really contracting well, and it's just going to keep bleeding. And then maybe as it's coming out, it gives the last bleed, and that's what starts bleeding again, right? So that's a situation, a retained placenta. I had someone, the only patient that I had that had a hemorrhage. I think it was maybe two days after the birth. And she said this to me afterwards. She didn't listen to my breast indications, and she was upstate. She got on the car, was driving back with her husband, like nursing the baby on the car seat. I don't know if you guys ever done it, but like, when you're trying to nurse the baby while the baby's in the car seat, right? So basically you're kind of like on your knees on the seat and just like leaning on the car seat and feeding your baby. She was doing that for 3 hours, like as they were driving. So they drove back to the city, stay in the city for one day, and drove back upstate. And that's when she started to bleed heavy. And I was like, well, of course that's going to happen, because you had no business doing that, right? Like getting in the car and all that. So there, usually when these postpartum hemorrhages happen after 24 hours, is because something really triggered it. It wasn't just out of nowhere. Again, like I said, I don't know your friend's experience, but that was my patient's experience. But most of them are going to happen in the first few hours after the birth. Any other questions?
I think this has been so informative and so helpful. And I think in many ways it's also very eye-opening for a lot of people. I think sometimes we think the baby's just going to come out and all is going to be nice and dandy, and we don't think about what happens right after. So yeah, I'm so grateful, Tanya, that you did this for us, and I'm so excited for everyone who's here listening to it, and for everyone who's going to listen to it in the future. And yeah, and also just a reminder for all of us that when a friend of ours gives birth, how much we can offer to step up, and in what ways we can offer and help them out, be there for them. I want to say a huge thank you. I gave birth fairly recently, and many of you on this call stepped up there for me to be my community and my care. So being there for each other, and not having expectations that somebody gives birth and suddenly they're all dressed in high heels, looking gorgeous at the next event. So yeah, thank you so much, Tanya, and thank you everybody for joining. And again, a huge thank you to our sponsor for tonight, who sponsored anonymously in honor of all of the mothers and the soon-to-be mothers. Thank you so much. We'll see you again next time. Good
All
night.
right. Thank you. Good night, everybody. Bye bye.
Thank you.